Joining us now to talk about all of this and much more, Dr. Corina Marcu. She is the Associate Vice President of Medical Affairs at Hartford HealthCare St. Vincent's Medical Center. Dr. Marcu, thank you for joining us tonight. Let's talk about this mask situation in schools right now. Many parents upset, as you well know, that the children are still required to wear face coverings. That actually includes New York State Assemblyman Kieran Lawler, who says his kids will not be masking up despite the state guidelines in New York. Take a listen.
It's time for them to literally breathe free and figuratively breathe free. I'm not saying every kid should be maskless. If you want your child to wear a mask or 2 masks or 3 masks, I think that's fine. Do what you think is best for your child. But my wife and I know what's best for our children at this point.
All right, so doctor, I'm not going to ask you to wade into the political argument to all of this because there certainly is an element to that. But what about that idea that students at this point with rates this low should be able to ditch masks in school right now?
I think the opinions are very polarized in this, and it's not just political. It's I think it makes a difference in states where the infection rate is low, when the vaccination is high. Those states can issue guidance that or mandates about masks, and they're looking at CDC to provide guidance. And CDC, I believe, is working, and they stated by the end of the month they'll release some guidance. Again, it's really up to the state and local authorities to mandate masks or not in schools, but CDC will provide some guidance. And I think we need to look at this in a context of what's happening around the world, and specifically with the new variants of concerns. Because yes, we're in a very good place right now, but looking at UK, they're experiencing a 50% increase on their infections right now. So I think we need to look at all these decisions in the context of what's happening in the world.
We're going to have more on those variants and what's taking place in the UK later on in this show. But doctor, on this issue of the mask, we've heard some parents say they're concerned that wearing the mask could have a negative impact on their child's physical health, psychological as well. Is there any science behind that?
I'm not aware of any science behind that. I think the common denominator is that we want our children in school and we want them to be safe. We've seen some recent studies showing that about 30% of the teens that end up in a hospital with COVID end up in the ICU. 5% of them are intubated, are ventilated. Indeed, about, again, a third of them are completely asymptomatic. But if we can avoid any teenage patient from getting into hospital sick with COVID, I think we should do that.
Well, doctor, as we heard before, Pfizer's moving forward with trials for its vaccine in children under 12. But even if approved, it looks like many parents just don't want their children to get the shot. A new study found that 45% of parents say they're not very or not at all likely to get their child vaccinated. Just 15% said their children already had received a vaccine. Doctor, we've heard many of the reasons why some parents say they don't want their kid to get the shot. Do you think those opinions, though, might change in the coming months?
It might. When you look at the vaccination rate for the past month, when the 12 and above were eligible to receive the vaccine, about 25% of the kids that age range already received a dose. And again, it's a new vaccine. Parents, they need to ask their questions. They need to be confident that the dose, it works. Yes, we know the efficacy is there. They just, because of the newness of the whole vaccination, some parents need more time.
So if ultimately we see FDA approval and not just temporary authorization, do you think maybe that's a game changer for public opinion?
It might be. And that's true for a lot of healthcare settings, because once the vaccines are fully approved by FDA, some organizations can move towards a direction of mandating vaccines, and schools as well, because we know some vaccines are mandated for school attendance.
All right, let's talk about work then, doctor. As things reopen, officers are bringing workers back. Some employees say they have concerns, though. A new poll finds a little more than half of Americans support requiring proof of vaccination to return to work. That's according to a new Axios Ipsos poll published Tuesday. Doctors, what step can workers take then to protect themselves if they do return to the office?
Again, in addition to the vaccination, what really worked along the way, again, the mask when you're in close encounters, so if you're not vaccinated, the social distancing, the travels to the parts of the world where the incidence of infection is still high, all of the above.
All right, well, Dr. Marcu, don't go anywhere. We still have much more to talk about tonight, including this exclusive interview we have with a leading doctor from Pfizer about the company's COVID-19 vaccine and what it means for you moving forward.